Welcome back. Did you know 20 million adults are diagnosed with sinusitis every year? And for many Houstonians, Courtney, the fall season is also known as sinus season.
Oh, for sure. Dr. Michael Kaplan with Kaplan Sinus Center is breaking down 5 telltale signs that you have a sinus infection instead of a cold. It's great to see you.
Good to see you guys.
You know, let's talk about this because I think one of the symptoms that people live with, it could be maybe, 20 years. People, oh, I have a headache and head pain. It's just a cold.
Absolutely. And this time of year, allergy symptoms can mimic a cold and people don't know. Do I have an allergy? Do I have an infection? When do I need to come in to see the doctor? You're right.
And
Absolutely.
Is it true, doctor, that if you get a headache that sort of occurs not just in your head, like your forehead, you can also feel it in your upper jaw, the teeth, in between your eyes, the neck? I mean, where you're experiencing that pain, isn't that sort of a key thing to look for?
Sure. Headaches behind your eyes, on top of your forehead, behind your cheeks especially, those are indicators of a true sinus infection. The allergies are going to give you, generalized stuffiness, itchy eyes, itchy nose, but the pressure, the discolored changes in your mucus, those issues, those things are more indicative of an infection.
And let's be honest, I mean, we know the longevity of a cold, Dr. Kaplan, and having a sinus infection not treated can really prolong and be very painful.
Sure. I mean, if you're having symptoms for more than a few weeks, certainly more than a couple of months, you're most likely experiencing some type of an infection. If it's, 3 to 5 days, it's probably just a cold or allergies. That's accurate. Mm-hmm.
Okay, and I know we're past lunchtime now, and this is kind of gross to say, but the reality is a lot of people experience some sort of nasal drainage. What should they be looking for coming out of their nose?
If it's yellow or green, it's not normal. That's basically the bottom line there. If you're blowing out yellowish, greenish mucus, congestion, headaches, pressure, that's a reason to call your doctor.
And there's also fatigue can be associated with this. Is that just because of the amount of pressure that's going on?
Your body's fighting an infection. The immune system is stressed. So at any time the immune system is working over an override, you're going to feel tired. You're not sleeping as well, feel fatigue. Absolutely.
And we're seeing some of these symptoms pop up on the screen there for a moment, but cough, fever, sore throat, these are things that people can experience temporarily if they do have a cold. But the key here is if these symptoms are lasting for a long time.
Sure. It's the constellation of these symptoms in conjunction with the time frame lasting 6-8 weeks, 3 months. 100%. That's more indicative of an infection and a Kaplan sinus relief. Those are the issues that I can resolve in my office without you having to go to a hospital type setting.
And this is major relief for so many people. And we've talked about this before, Dr. Kaplan, is somebody says, oh, it's allergies, and I've been dealing with this for 20 years. I mean, the bottom line is we don't need to live like this and with this and suffer this long because the procedure is very easy.
Takes 20 minutes in the office on the vast majority of patients, and within a week or so, your quality of life is beginning to improve dramatically. It's that consistently good.
And that procedure, Dr. Kaplan, is the balloon sinuplasty. You already mentioned 20 minutes, right? Minimally invasive. So when people come in, let's say they schedule an appointment. I know you're really busy these days because October is crazy for allergies in Houston. Describe the process and when they can expect to just sort of resume normal activities like going back to work.
Well, the sinuses is like an hourglass, and that narrow canal in a true sinus infection, that narrow canal is blocked. And what I can do is open it up and establish much better drainage. It takes 20 minutes. You're either half asleep or completely asleep, depending on what you want. I can give you some medications by mouth. I can get you nice and relaxed and asleep with an IV. But in any event, within 20 minutes, we're done. You're walking out, and within a week, you're breathing and feeling better. Within 2 weeks, consistently better than you've been breathing in, and most oftentimes in years.
And we've heard from so many of your patients in the past about how well they're sleeping, how well their spouses are now sleeping since that procedure has been done. Let's talk about sort of the consultation, and a lot of these are covered by Medicare and most medical health plans. Is that right?
Yes. Medicare covers it, and the vast majority of commercial insurance carriers cover it completely.
And
Yes.
we should point out, too, unfortunately, it's not covered by Medicaid or community health care. And also, we got to talk about how you guys have been handling COVID, because the CDC has very specific guidelines. For someone out there who might be concerned about scheduling an appointment, walk us through what you guys have done to protect your clients.
Sure. Well, we're all wearing masks. I've got mine, obviously not right now. All my staff is wearing masks. We've got air purifiers in the room. We're doing temperature screenings, temperature checks. We're cleaning the rooms after each patient, whether they're a surgical patient or just an office patient. We're taking every conceivable step to make it as safe as it is in most hospital environments.
All right, Dr. Kaplan, we'll leave it there today. Thanks for helping us breathe a little easier.
You bet. Have a good day.
You too. And if you would like to schedule an appointment with Dr. Kaplan at Kaplan Sinus Relief, you can call 713-766-0204 or visit them online at kaplansinusrelief.com.